Hello everybody, I am Dr. Bhavya Bayana, Consultant Surgical Oncologist, Sri Pooja Multi-Speciality Hospital, Habsiguda. So today we will be discussing about a very important topic, that is cervical cancer screening. So I will be discussing about who should get it done and how frequently should you get it done and what does the procedure involve in general. First, you have to understand that cervical cancer is very rampant in India, especially in women. This is the second most common cancer, and if you take about 10 cases in the world, we are giving around 2 cases. That is 1/5 of the global burden is from India only. So it is high time that we prevent this cancer, because only cancer which is completely preventable is cervical cancer. It has vaccination available, which I have discussed in my previous video, and it has cervical cancer screening methods available. So in this video we will be discussing about cervical cancer screening methods available. So you must understand that why should screening be done. So the beauty of this disease is, once you are infected, for it to become cancer, it takes years, and in these years also you will have some pre-invasive stages. That is, it's not cancer, it's not normal, it's an abnormal finding which we can pick it up, and then we can give simple treatments and prevent it from becoming cancer completely. So what are these tests? Generally we have two types of tests, that is pap smear, and you have HPV DNA testing. So in pap smear, what we do is, like you shed your skin, even your cervix. So cervix is like the entry point, it's the neck, like you have uterus, womb, and cervix is the entry point. So from the cervix you have cells shedding down, like you shed your skin or your skin peels off, it's natural for some cells to shed down. In this test, what we do is, it's a simple gynec examination, like you get it done for any pelvic examination. You go and lie down, and we insert a small speculum, and we take a small brush, and these cells which are coming down, we just take a brush and we just turn it around in 360 degrees and collect the cells which are being shed. These cells will be examined and we will see if there are any abnormalities. This is not a painful procedure. It is a very simple, very easily done and very quick procedure, which is just mildly discomfortable. It is more about the inhibition in our brain. Most of us try to postpone it, thinking that just because of inhibition, or we just do not want to get a pelvic examination done. I understand that is a very common female thing, but this is very, very important, and it is not painful at all. So once you get a pap smear done, there are two types of, maybe once you go to hospital you will get 2-3 options. One is a routine conventional pap smear, in which the microscope is examined, the cells are directly deposited on the slide, or sometimes we have a liquid based cytology. Nowadays most of us are doing liquid based cytology, not that it is more effective than the routine pap smear, but if we want to go for reflect testing when we have doubt, it is easier because the sample is already available. And the cost, once you come to cost, the liquid based cytology is little more costly compared to the routine conventional microscope examination. So you can just get whatever is feasible in your economic range. And once this test is done, it is examined under a microscope. This is a pap smear. There is another test called HPV DNA testing. In this, as I said, the HPV has hundreds of strains. In this, there are few strains which are of high risk. They cause cervical cancer. They are very particularly notoriously known for causing cancers. These high risk HPV DNA infection, whether it is there in you or not, we try to assess by checking the DNA in you. Once we know that you have some HPV DNA, you are infected with a high risk DNA, then what to do, that you will discuss with your doctor. So you can either get a pap smear done or HPV DNA testing done, or sometimes you can get both the things done together, that is called co-testing. So how should get it done? So any women with the cervix who is above 30 years in India, and is whether you are sexually active or not active, you have to start getting the cervical screening test done. It can be done if you are getting a pap smear done, you can get it done every 3 years, or if you are getting a HPV DNA testing done, if your result is negative, you can keep repeating it every 5 years, and you continue it till you are physically fit to tolerate any treatment. Generally we advise cervical screening to continue till 65 years. So after 65 years we do not know, because if you are not infected, if you don't have any changes till 65 years, maybe it will take time. As I said, cervical cancer takes time to progress. So we think by the time you get cancer and all, you'll not be fit to take the treatment, because once you get to know something, only if you are effective and you're able to get treatment, that is when you try to know the disease. So if you're a fit person and if you think that you can go on till 100 years, you're good, the physical condition is good, you can still continue to get a screening done. And one of the very frequent questions which people ask is, my uterus is removed. A lot of people have hysterectomy done. You will be amazed at the number, because you get a lot of patients who have already their uterus removed. So whether to get cervical cancer screening done or not. So when your uterus is removed, you have to find out 2-3 things before deciding whether to continue screening or not. One, why was your hysterectomy done? Whether it is for a cancerous condition or some benign condition, that has to be known. And the second point is, you have to know whether the uterus which was removed is sent for examination, microscopic examination or not. That histopathological examination should confirm that you didn't have any disease. That is another important. So if you do not know whether your uterus is examined or not, if you do not remember the report, you can get the test done once. Or sometimes in some surgeries, cervix part, that is, as I said, it's the entrance to your uterus, that part is left out and only the uterus above is cut. That is called subtotal hysterectomy. If that is done, you still have your cervix left out, so you still have to continue cervical cancer screening. So how do I know it, doctor, and what to, it is a very confusing topic, and it is better to consult your doctor and let them examine and see. If you're post hysterectomy, let them examine and see whether your cervix is completely removed. Let them go through your previous reports, and then if it's not required, they'll suggest you not to continue screening anymore. But then if you had any pre-invasive lesions like a CIN1, 2, that is intraepithelial neoplasia, I said these are not cancers, but they are pre-invasive. It can progress to cancers. If your uterus was removed for these causes, then you will still have to continue pap smear screening, because there is a chance of recurrence. It can become cancer in the vault left out. Whatever vaginal part is left out, even there the cancer can come back. So that is why we still advise them, to cancer patients or any pre-invasive patients, we advise them to continue cervical cancer screening, that is a pap smear or HPV DNA testing. So main take home message, main thing to remember is that any woman between 30 to 65 get a pap smear or HPV DNA testing done. If you are getting a pap smear done, get it every 3 years. If you are getting a HPV DNA testing done, get it every 5 years. So once your results are abnormal, what happens next? That is a very common query. So what happens next is, we generally do a colposcopic examination and take out a small biopsy from any doubtful lesions. And these lesions, if they are anything abnormal, there are some procedures. For early lesions, we can just cut it off with a knife, or cut it off with a heated knife, or sometimes we just give a cold therapy, cryotherapy. So these are the options available. You need not always go for hysterectomy if you do not have cancer, and hysterectomy is not indicated even when you have pre-invasive conditions, that is, you're prone to cancer, still hysterectomy is not indicated. We can cover it with simple procedures like LEEP, cryoablation or cold knife conization. These are the options available. So if you have any doubts regarding cervical cancer screening, please comment in the comment section. We'll discuss further. Thank you.